EMS provider, you will likely encounter a patient who has an implanted mechanical support known as a ventricular assist device, or VAD. It is important to recognize these devices, understand their purpose, and know how you can best support a patient with a VAD. The human heart is an organ that maintains continuous blood flow through the body via the circulatory system. It functions like two pumps working simultaneously, with the right side moving deoxygenated blood from the body through the heart and to the lungs for oxygen. The left side pumps the oxygen-rich blood back through the heart to the body where it perfuses the organs. Blood pressure, systolic and diastolic, is a measurement of the high and low pressures of the heart as it contracts and relaxes to move blood. The heart is preload dependent and afterload sensitive, so there must be enough fluid and resistance to maintain adequate blood flow. Mean arterial pressure, or MAP, is the pressure necessary to perfuse distal organs and tissue. If a person's heart cannot pump well enough to meet the body's needs or is overloaded by fluid volume, there may be an ineffective mean arterial pressure. A ventricular assist device may be an option to improve heart function. A VAD is a mechanical pump that is attached to a person's heart to improve cardiac output. It replaces the function of the heart's ventricle to circulate blood through the heart and to the rest of the body.
A ventricular assist device is a continuous flow device that supplements the natural function of the heart. It's typically used for the left ventricle, but occasionally the right. And in rare instances, it can also be used to supplement both sides of the heart. A patient who requires a VAD is a patient who has had heart failure or has heart failure due to a myocardial infarction, multiple myocardial infarctions, or post-cardiotomy shock due to an infection or post-surgical procedure.
A VAD may be placed as a temporary treatment for reversible heart failure or prior to heart transplant or transplant candidacy. It may also be a permanent therapy for heart failure to enhance a patient's quality of life. Most patients would not be a candidate for a VAD if they have renal, pulmonary, liver, or neurological disease and/or bleeding or clotting disorders. There are different models of ventricular assist devices, but most VADs have both internal and external components. Inside the chest, there are inflow and outflow cannulas and a prosthetic pump. A driveline connects these internal components with a system control, which manages pump operations. There are typically two lines from the system controller that connects to external battery packs.
The control sits outside the patient's body and will indicate that the pump is functioning appropriately. Off of the control is the drive line that enters the body and becomes the percutaneous line. That meets up with the VAD itself, which is attached to the ventricle and is providing that continuous flow to the body.
You will have additional considerations for a VAD patient during assessment and treatment. A VAD patient may experience a medical condition that negatively affects the VAD function, or the device itself may malfunction. It is important for EMS providers to recognize conditions that can affect VAD function, complications or malfunctions of the device, and actions that EMS providers should take or avoid when treating a patient with a VAD.